Hi, my name is Rachel, and for my research project, I explored NSAIDs as an alternative for opioid use in pain management. I'll start off by talking a little bit about me and why I chose to do this research topic in the first place. I chose to research opioid use because last year I'd heard a lot of news about the opioid crisis in America and how it's getting worse, how many lives it had taken, and also heard about the people in my community suffering from fentanyl overdoses and fentanyl addictions. And at my school, I've been shown a lot of documentaries and videos about the opioid crisis. And I wanted to do something about it, but I didn't really know enough to do anything. So I decided that through this program, I was going to um, research opioid use. And I also wanted to try and see if I could research a pain management alternative for opioids because I knew that they were typically being prescribed for pain management. And I came across NSAIDs, and that was the one that was the alternative that I chose to focus on. I'll start off by talking a little bit about how opioids and NSAIDs actually work to reduce pain. So the way opioids work is by acting on opioid receptors on nerve cells throughout the body. Opioids will trigger the release of endorphins, which dulls one's perception of pain while boosting feelings of pleasure. This release of endorphins is what's going to make opioid use so addictive. In fact, research has shown that the risk of continued opioid use spikes at just 5 days, which is insanely fast. The problem with this is that one of the known effects of opioid use is that it depresses breathing, and in high doses or when used to stop breathing and you suffer an overdose. Naloxone can reverse symptoms of opioid overdose by binding to opioid receptors and blocking its effects. However, multiple doses are often required. NSAIDs work differently, and they work by blocking the COX enzyme, which is responsible for producing prostaglandins. These are chemicals in the body that contribute to inflammation, pain, and fever by raising temperature and dilating blood vessels. NSAIDs will work by blocking this pathway and reducing pain in that way. What's unique about NSAIDs and what sets them apart from opioids is that they have no abuse potential. So now I'm going to give a few more facts about opioids. In 2021, there were 21.2 drug-related deaths per 100,000 people in the US, compared to Norway with just 5 and Germany with 1.7, making the opioid crisis a crisis that's uniquely American. Unrestrained prescription for drugs such as OxyContin went on for 15 years, increasing exposure to opioids by about 400%. Opioid use is also heavily intertwined with other drugs and disorders such as HIV. Also notable is that deaths are disproportionately concentrated in areas with a lack of healthcare. Some more facts about opioids is that, these are going to be about illicit opioids. Illegal fentanyl is being mixed with other drugs such as heroin, methamphetamine, cocaine, MDMA, and this is happening pretty often without the user's knowledge, which is what allows for so many deaths. Much less fentanyl is needed to produce a high, which makes it cheaper, which is why it's so common. And it's sold in many forms, or illicit fentanyl is sold in many forms, such as powder dropped on blotter paper like candies, eyedroppers, or nasal sprays, or made into pills that look like prescription opioids. Opioids are also connected with COVID. COVID is thought to have exacerbated opioid use and overdose by a lot. Deaths jumped 30% during this time. Social isolation, stress, using drugs alone, decreased access to substance use treatment, and harm reduction services or emergency services may have contributed to this exacerbation. And those with substance use disorders including opioid use disorders, are at a higher risk for getting COVID. Now that I've gone through some of the facts and how opioids and NSAIDs work, I'll move into my discussion. And the way I conducted this research project was just reviewing the clinical trials and journals and articles and such that I found online and analyzing them. So what we found from doing this research was that in treating acute and chronic pain, opioids and NSAIDs were both effective in treating pain. They were about the same as one another, and neither really provided an advantage or a benefit over the other in terms of pain control and pain management. However, NSAIDs do not have the same abuse potential as opioids do, which is what makes it more appealing. Both have their risks. Long-term opioid use has the risk of addiction and respiratory depression, which can lead to overdose. Short-term use risks long-term addiction with these opioids. Long-term NSAID use increases the risk of exacerbating certain issues such as ulcers, acute renal failure, cardiovascular issues. But short-term use of NSAIDs is typically not harmful to the user. In general, NSAIDs are a suitable alternative for opioids in pain management. However, every patient is going to be different, and they should be treated with their own individual treatment plan. Medication should also be administered in the smallest dose that's still effective and adhere to precautions when it comes to these medications. So moving on into my reflection, I'll just start off by saying that working with my mentor was a really amazing experience. My mentor, Dr. Olga Chain, made herself available to me as a resource basically 24/7, which I really appreciated because I know she was a super, super busy person. And just working with someone established in the field of study that I wanted to pursue research in was awesome. And being able to do my research on something that I actually wanted to do was totally different from just being in the classroom and writing a paper there, because it was just so individualized and I got so much one-on-one support. And I'm just so grateful. From this experience, I learned so much about the topic that I was interested in, as well as the research process in general. Initially, I had a lot of trouble with organizing my thoughts because there's just so much information and I got overwhelmed. However, my mentor was very helpful in the process, and she encouraged me and she gave me the determination and tools that I needed to move forward with my research. Overall, I'm so grateful for the experience. I've turned in my research paper, but I hope to continue working and researching in this area, as opioid abuse is something I am very passionate about, and it is an issue that is still ongoing. I am very grateful for the support and the connection I've made through this program, and I can definitely say that I am a more experienced and knowledgeable person, and I owe that all to my mentor and Talaria. So thank you.